Hello class, my name is Keely and I am sharing a research article titled, "It's Better to Have 3 Brains Working Instead of 1." It was written by Kalocsai, Amaral, Piquette, Walter, Dev, Taylor, Downar, and Gotlib Conn. The article was published by BMC Health Services Research in July 2018. The study focuses primarily on how to build therapeutic alliances between care team providers and family members in order to help in the care of critically ill patients. The study relates well to our recent study of family engagement dynamic in communicating about a patient's plan of care. I'll begin by summarizing the key portions of this research case. First, the article authors introduce the concept of the therapeutic alliance, which is built through 4 interrelated dimensions of the family-provider relationship: effective information and empathetic communication, integration of family members into the care team, collaboration between a patient's family and providers around common goals, and the empowerment of family members in decision-making processes. Next, the research authors described their research study design, which consisted of 30 to 80-minute interviews. A cultural anthropologist interviewed a total of 19 different family members who were visiting an adult ICU patient at a hospital in Toronto, Canada. An interview guide was prepared based on a literature review of therapeutic alliance, communication, and conflict in the ICU. An inductive and deductive approach was then taken in transcript analysis and was used to really identify key trends in this study. Finally, the study explained how the results of these interviews aligned and, in some cases, highlighted a better opportunity for the development of the 4 dimensions of a strong therapeutic alliance between patients, family members, and the care team. Specifically, the study had 3 key findings. First, ICU nurses and physicians were found to serve complementary roles, in which together they helped support positive relationships with family members among the areas of communication, integration, and collaboration. Physicians were uniquely found to support families' empowerment in decision-making processes. Finding number 2 was that family members' lack of understanding in ICU processes, medical jargon during rounds, and physician availability overall served to challenge the family integration dimension by actually increasing the power distance between families and physicians. The third finding was that informal interaction between family members and physicians was found to be a missed opportunity in facilitating positive relationships. They also found that there was inconsistent inclusion of family members at times in medical decisions. This really challenged the family empowerment dimension. As a result, family members may have felt alienated from the care team, and they expressed that they were excluded, they felt, from care decisions. Now that we've summarized the research study, let's critique it through the lens of healthcare communications. It's important to note there were a few limitations to this study. It only consisted of interviews with English-speaking family members in the medical ICU seeing adults. Additionally, observations were experience-based rather than directly observed, and the study focused only on interactions between family members, nurses, and physicians. This excluded the role that other care team providers, such as social workers or respiratory therapists, could contribute in developing a therapeutic alliance. I personally believe the core therapeutic alliance dimensions of communication, integration, collaboration, and empowerment between the care team and family members were very well identified in this study. And the authors did make the important note of illustrating that these 4 dimensions are all really interrelated. Each of these dimensions are key to patient-centered, family-centered care. As we've learned throughout this course, it should be emphasized that a foundation of mutual trust is absolutely necessary in the patient-family-provider relationship for an effective alliance to even be possible. Without trust, none of the therapeutic alliance dimensions identified in this study could really be realized. Overall, this study highlighted many important considerations in communication, which we've studied so far in this course, such as the importance of plain language, active listening and discussion and decision-making, health education that may be needed for family members with low health literacy, and even the role that self-disclosure can play in the informal interactions between physicians and family members, and how this can contribute to emotional connections with them. Now I'm interested to see what reflections you have about this case study. I have 4 questions that I want to propose. First, as a family member of a patient, have you ever been present during patient rounds? Did you come away from that experience with more clarity in what would occur or more confusion, and why? My second question is, what resources can your organization make available for patients' families in order to educate them and help them feel more empowered in making complex, very difficult medical decisions for their loved ones? My third question is, participants in the study found some family members were really confused about the identity and the roles of the different care members that were entering and exiting their family member's room. Have you experienced this before as a patient or a family member? What steps could the entire care team take together to better identify themselves and explain their role in the patient's care? And for my final question, nurses in this study were found to more easily build emotional connections with family members as they have more frequent contact with family members throughout the day. How can physicians build emotional connections with family members given the limited time that they have available with patients? To conclude, having 3 brains working between a patient, physician, and a family member is the most effective way to deliver care that's most appropriately tailored to a patient's unique needs. It's important to remember that family members often know a patient best, and their knowledge and their involvement in care can help result in better patient outcomes as a result. However, this collaboration is only possible through trust and a therapeutic alliance approach in which a family member is incorporated into the care team through focused communication, integration, collaboration, and empowerment from admission to discharge. Thank you for listening, and I'm looking forward to our discussion about this interesting case study.